If your favorite foods routinely trigger heartburn and indigestion, your discomfort may be symptoms of a more serious condition known as gastroesophageal reflux disease.
What it is the process of gastric contents, or the contents of the stomach, refluxing back or going backwards into the esophagus. Chronic reflux of acid causes irritation of the esophagus. Then you get esophagitis, which is inflammation of the esophagus. The chronic inflammation, especially if you don't feel it, goes into what we call Barrett's esophagus. That's a precancerous change. And then from Barrett's, it can go to esophageal cancer. So that's the risk if it's not diagnosed or not treated. People typically nowadays, actually, they self-treat. Now, there are at least a handful of different drugs that actually block the production of acid.
The pill at first was a magic pill, makes everything disappear, you can eat whatever you want. And then there were some times where I would still feel pain.
So you're gonna have the reflux, you're gonna still have the contents of your stomach come up, except when you take these medications, you don't feel it because it's not acidic. The problem is a mechanical change in a valve that's supposed to keep things in the stomach. The most advanced treatment for this condition is really the mechanical fixing of this valve to basically revert it back to the normal status. And the way we do that is basically going down there and tightening the valve by doing this particular procedure called TIF, which stands for transoral incisionless fundoplication. Benefit of doing the TIF as opposed to doing the traditional surgery is that it's a lot less invasive. It doesn't have any of the long-term effects of the actual traditional surgery. The most important benefit is that it's a permanent procedure, permanent solution for reflux. You also are going to have the freedom of eating whatever you like.
For Time Warner Cable, I'm Kyle Mackey.